Trevor, well, welcome back. It's always a pleasure having you on our show to educate us on the most recent products that you have at Orthomolecular. We've had really good luck with Orthomolecular products, and we love you sharing your knowledge and wisdom about these products. So today we're going to be talking about HiPhenolic. It's a new hot topic of weight loss product that we're going to be talking about. It kind of is in the category of some popular drugs now that we'll be talking about for weight loss. So Trevor, go ahead and tell us about HiPhenolic.
Sounds good. Thanks for having me, Shawn. So in order to understand this product, I think you have to understand the greater context. I know you understand it, but I think there's very few trends that are as exciting or as popular right now as the weight loss and the peptide use category of pharmaceuticals. So these are the brand names, Ozempic, Wegovy, Mounjaro, and patients are having extreme success in losing weight. And the way these work is they all work on your satiety hormone, right? So this hormone's called GLP-1 or GLP-1. Basically, it sends signals to the brain and the brain back to the stomach and the intestines that, hey, you're satiated, you're not hungry. And so with that, there's also some side effects, and it's up to the practitioners, right, to how to integrate or not these formulas. And that's not the goal of my conversation today. The goal of my conversation is to discuss the pathway and the mechanism that's working for people is managing GLP-1 satiety. And then on the flip side of that, managing ghrelin, the hunger hormone. So HiPhenolic is a formula that uses natural botanicals and natural green coffee bean extract to manage that same pathway from a more alternative medicine to complement someone who may be considering using the peptides or maybe can't afford them or may not want to go that route because of the side effects, or frankly, maybe wants to titrate off of it long term. So this is what it would look like if you're starting a dietary regimen. And so this is what it looks like when you start a calorie restriction program. And essentially, person on the left loses weight, you're happy with the results, the scale changes, the body composition changes, but the immediate response in the brain and the stomach and the intestines is I'm hungrier and I'm not satisfied. And that hunger is ghrelin, the hormone goes up, and the lack of satiety is GLP-1 going down. And ultimately, that response is that 4 to 8 week period. You do carnivore, you do keto, you do paleo, you do Atkins, whatever it may be. But you are now saying, how can I survive this long term? This isn't scalable. I can't stick with this. And a lot of people relapse at that point right here. The body is telling you survival mode has kicked in. You need to eat. I want to go backwards to homeostasis. So this is the exact point at around 8 weeks where you need to insert something that can help you stay on the program. And so that's plant polyphenols. And if I move towards this education, Shawn, can you see this side?
I sure can.
This would be the management of GLP-1, so satiety in the brain, and the management of ghrelin, your hunger hormone in the brain, and its connection to the intestines using lemon verbena extract and green coffee bean extract, which is in HiPhenolic. And you'll notice all these other measurements are downstream: systolic blood pressure, improvements in LDL, body weight. These extracts do not improve these directly, in my opinion. What they do is they manage the brain, which helps manages what you eat, which improves everything. And here's the final result. Like I said, you could look at body weight, you could look at BMI, you could look at blood pressure, but these are all downstream of one very, very important pathway that a lot of the peptide drugs are targeting, which is if you change your diet and include plant polyphenols, you can actually manage ghrelin, GLP-1, and leptin. So what you'd see here is someone changes their diet, their ghrelin should skyrocket because they're starving after 8 weeks. Their GLP-1 satiety should plummet because they're starving after 8 weeks. But when they inserted metabolate, which is in HiPhenolic, their GLP-1 went up 55%, even though they were dieting. And their ghrelin went down 10%, even though they were dieting. And obviously they're losing weight, so their leptin produced in their fat went down. So ultimately, the goal here is this is not a weight loss product. This is a product you use during lifestyle change to manage the brain. And the ingredients are what I just showed you, metabolate at the exact dose used in the 8-week trial, which is lemon verbena and hibiscus, and green coffee bean. All three of these work on GLP-1 and ghrelin, and they also upregulate metabolism. And so, to summarize, you have raw materials that are natural. You have a mechanism that is very popular right now that's working for weight loss. And what you want to do is just manage the brain as you work on whatever clinicians recommend as a healthy dietary program moving forward.
And as you and I both know, long term, the answer is not taking some drug like a peptide drug to keep weight off. It's changing your habits,
Right.
and even HiPhenolic. I think with any supplement or drug, long term, you should change your lifestyle, change your diet to keep a healthy weight.
Absolutely. And to my understanding in the integrative community, these peptide drugs are not being used long term, maybe 3, 4, or 6 months max. And even some clinicians not using them at all due to the side effects. But the point here is that these are whether you're using HiPhenolic or you're using the actual Ozempic, Wegovy, and Mounjaro, you're trying to kickstart someone into success and belief that I can manage this and I can start a dietary program. And then after that, it's time, like you said, to stick with the program and to scale this long term. So there's certainly some accelerated ways to benefit in the first 6 months. But yes, like you said, lifestyle signals with healthy diet, exercise are going to be the most powerful long term.
Awesome. I love it, Trevor. Thank you so much for your education today.
Thanks, Shawn, for having me.